Valley fever fears, cases on the rise, the painful lung infection spiking across the Golden State.
The California Department of Public Health confirms more than 11,000 cases statewide and expects that number to keep on growing. The Central Valley getting the brunt of it, with Stanislaus and San Joaquin counties seeing a nearly 200% jump in cases. We've got a lot to get to tonight. Thanks for joining us. I'm Curtis Meng.
And I'm Hunter Sowards, your reporter covering Stanislaus County. Nina Burns starting us off here at 5 Live in Modesto, getting answers on what is causing the uptick, Nina.
Curtis and Hunter, that same report shows that the Central Valley is seeing the biggest increase in cases. Now, I did speak to Stanislaus Health Agency, who tells us who's at the most risk and why.
So it's typically airborne.
Stanislaus County Health Services Agency Kamalesh Kaur says valley fever can be hard to detect due to symptoms mimicking those of a cold or flu.
Cough, headache, fever, body pain, rashes, and things like that.
But unlike a cold or flu, valley fever is not a virus, but instead an infection caused by fungus that grows in soil or dirt.
It's coccidioidomycosis, and usually because Central Valley or California in general, we have this wet and dry weather, so you have winter and then you have really dry summer, so that creates a condition where those fungus, develop in soil, underneath the soil.
Kaur says those at most risk are construction and field workers.
And especially agricultural land that hasn't been tilled for a very long time, that's where the fungus resides in undisturbed soil. People who are working in those farm areas or, untilled land, they're more at risk to getting exposed to it.
Stanislaus County has seen a 193% increase in valley fever since 2022, going from 58 cases to 84 cases in 2023. And as of November 30th of this year, 208 cases, while San Joaquin County is seeing even more of an increase at 199%. In 2022, they reported 95 valley fever cases. In 2023, 218. And as of November 30th of this year, 468 cases. Kaur says the recent extreme weather in winters and summers could be a reason for the rapid increase. Still, there are precautions anyone at risk can take.
It's a good idea to wet the field before they start tilling it, so they don't have that much dust flying in the air, so they don't breathe in a lot of dust and spores.
And because valley fever is airborne, Kaur suggests that any of those employees who are out on those fields wears an N95 mask to cover both their mouth and nose. I'll send it back to you guys.